At the onset of the COVID-19 pandemic, people who use drugs found themselves at increased risk of harm not only from the virus, but from lockdown conditions which failed to take our community's needs into account. Many of the health services and harm reduction programs which we rely on were closed, defunded, or made inaccessible during the pandemic, resulting in increases in overdose as well as forced withdrawal. Peers face an increased threat of criminalisation under lockdowns, and were too often forced into situations which left us with a high risk of exposure to the virus. The pandemic exposed and amplified existing inequalities, resulting in the already scarce funding landscape being diverted away from people who use drugs and other key populations. Yet despite these challenges, people who use drugs stepped up in unprecedented ways during the pandemic. As we always have, peers around the world look after each other by providing essential care and services to meet the needs of our communities where the state was absent. Advocacy efforts led by networks of people who use drugs successfully influenced policy and funding streams, alleviating some of the barriers caused by lockdowns. At the onset of the pandemic, the international network of people who use drugs committed to listening and learning from the community by convening an international working group of peers to help us formulate a plan to address COVID-19 at a global scale. The working group determined one of the best things input could do was monitor and report on the health and rights of people who use drugs under lockdown environments. To collect this information, we ran an open survey translated into 7 languages, developed in collaboration with members of the working group. The survey ran through 2 phases of data collection and in total received 290 responses from 52 countries. Our survey reports confirmed what our community had been telling us. People who use drugs were largely being left behind in the pandemic response. Again, under the advice of our working group, one of the first things input did was disseminate comprehensive harm reduction information for people who use drugs during the pandemic. Partnering with 3D Research, we developed a series of harm reduction guidelines specifically tailored for lockdown conditions. These resources were distributed electronically and are still viewable on the Input website. Similar guidelines were published by other peer-led networks, such as the European Network of People Who Use Drugs. With support for existing social and health services dwindling, it fell to peer and community-led organizations to pick up the slack. Thanks to the support of the Robert Carr Fund, Input was able to provide small grants to communities that supplemented sudden interruptions to harm reduction and health services. With this assistance, hundreds of people across 12 countries were able to receive PPE, food bags, and harm reduction equipment distributed by peers at the grassroots level. The Italian Network of People Who Use Drugs provided 18 communities with education and provisions of methadone. Through these activities, peer-led networks were able to fulfill core objectives to provide aid and care for their communities. Another terrific example of a peer-led response was in South Africa, where strict lockdown measures, combined with poor access to methadone or other forms of OAT, and a lack of medical support tailored to people who use drugs, forced many street-based people into painful withdrawals. In response, the South African Network of People Who Use Drugs began to purchase and distribute medication to ease symptoms of withdrawal for street-based people and those seeking refuge in shelters. These actions provided relief to a community of people who were otherwise left behind by the government's response. They also provide the basis for the newly established Belhaven Harm Reduction Center in Durban, which provides critical services for people who use drugs such as methadone management, syringe exchange, and testing and referral for HIV and other communicable illnesses. At all levels of government, peer-led advocacy refused to be stifled during the pandemic. With the inadequacies of our health and social systems fully exposed, we sought to seize opportunities to present solutions that our communities have always known were important. Our survey reports have been critical for informing this advocacy work. A commentary published in the International Journal of Drug Policy by Input drew from our reporting to present a set of recommendations to UN agencies, governments, donor agencies, academics, researchers, and civil society, challenging these actors to work alongside people who use drugs in the pandemic response. This commentary was the most downloaded article in the journal for consecutive months in 2020 and was listed as required reading for the Johns Hopkins Master of Social Work program. Again, drawing from our peer-led research, we collaborated with community and civil society or networks to influence the UNODC and the UN expert on the right to health to release global guidance to member states on how to effectively protect the right to health for people who use drugs during the pandemic. The Office of the High Commissioner on Human Rights also endorsed many of our recommendations in a statement signed by several UN Special Rapporteurs and treaty mandate holders. Additionally, our survey reports were cited by UN and other international institutions in their own reporting. UNH drew on data from this research in a report on COVID-19 and key populations-focused HIV programming, which emphasized the importance of ensuring access to HIV and other health services for key populations. Outside the UN, we worked to influence international donor agencies such as the Global Fund. When it was announced that the Global Fund had authorized $500 million for a COVID-19 response mechanism, Input developed resources to help communities navigate the process to stake a claim to a piece of the budget. While communities were still generally shut out of the process, one success story was in India, where advocacy led to $10 million in dedicated funding for key populations. The groundwork also paid off in 2020 with a new round of COVID-19 funding from the Global Fund. Advocacy by peer-led networks was also amplified at national and regional levels. As access to OAT was disrupted, the Eurasian Network of People Who Use Drugs made it an advocacy priority to demand OAT take-home doses. Community-led campaigns in Ukraine and Georgia successfully secured uninterrupted distribution of OAT by switching to take-home models of operation. This has been followed up with continued advocacy demanding take-home OAT be instituted permanently, seizing the opportunity to push on an issue people who use drugs have been advocating on for a long time. In late 2020, Input also launched a 5-week online campaign called Peers in the Pandemic, which advocated for key policy reforms informed by our peer-led research. Our demands were: declare harm reduction as essential, expand and maintain OAT take-home doses, prioritize peer-led responses, end punitive measures in harm reduction, and act on decriminalisation. The campaign allowed us to highlight many of the core issues faced by our community during the pandemic, reaching new audiences and establishing communication platforms which has been essential in our advocacy work in 2020 and beyond. What people who use drugs have achieved during the pandemic is nothing short of incredible. Time and time again, we have proven to be in the best position to look after the health and needs of our communities. As the Delta variant spreads and many countries return to lockdown conditions, it is imperative to increase support given to peer workers in our networks, and to seize this opportunity to change the policy landscapes which disrupt the health and rights of people who use drugs. We cannot stand by and watch the world return to business as usual. Only by truly listening to peers and giving us resources withheld for us for far too long can we begin to shape a world that truly leaves no one behind.